All right, and we are back. I hope everybody's having a great day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to discuss adhesive capsulitis of the shoulder. Say that 10 times fast. So what is it? How do you get it? Is it contractible? What is adhesive capsulitis? So have you ever heard anybody talk about frozen shoulder? That is adhesive capsulitis. So frozen shoulder is exactly as it sounds. You literally will lift your arm up and you can't move it anymore. Now, it may be painful, but this is where adhesive capsulitis or frozen shoulder differentiates itself from anything else. If I were to push as hard as I possibly can, there's no way my arm would go up any further. Now, a lot of people will confuse adhesive capsulitis and frozen shoulder for a painful shoulder. So a lot of people get here and be like, oh, it's just too painful to move. I can't. But if I were to come in here and move it, it might hurt really, really bad, but I could still move it. In the case of adhesive capsulitis, it is just stuck. You're not moving it at all. It is like just someone has literally frozen your shoulder. Now you have good movement down here. A lot of times it doesn't even hurt down here when you're moving it. It's great, feels good. I can do everything as long as it's down here. When you start to move and then you reach that end range where you can't move anymore, that's where it gets painful. So that's really one of the big differentiators, and sometimes people come in here and self-diagnose themselves with this adhesive capsulitis and just have really, really painful range of motion the whole way through. But myself or you are able to move it the whole way through the range of motion. That is not frozen shoulder, that's not adhesive capsulitis. So basically, if you are moving in a pain-free range of motion down here, but then just are not able to move it no matter what you do, no matter who pushes on it, that's adhesive capsulitis. So what happens is that you have, we'll call it saran wrap. So here's this arm bone here, which is your humerus, and there's a ball that sits here, and the ball just rests here, and around it is some ligaments that will form the capsule. Now we're going to refer to this as basically just saran wrap. So as you're moving through your daily motion, your joint just moves in and out, and as you're moving it, fluid comes in and out of that capsule. Well, what happens is over time, if you get an injury, a lot of times what happens and how adhesive capsulitis starts is you'll get injured. Maybe one day you'll reach overhead and you'll get a sharp pain. Now, this is not something you cognizantly do. It's something that you automatically do. Your body kind of says, we're not going to lift overhead today because it's really painful. So you stop moving overhead. Now, as you stop moving that range of motion, part of your capsule starts to freeze. The more parts of your capsule that you don't use, the more they start to freeze. So if you are using your full range of motion every day, all day, and you're lifting up overhead, it's going to remain fluid and you're going to have that full range of motion. But for a couple days, if you're like, oh, I don't want to lift my arm overhead, it's really painful, that capsule is going to actually start to freeze. That saran wrap is going to start to just close up on that joint. So now instead of being able to move it up here, you start to be able to move it here. Now you are not going to notice whether you can lift your arm up here or here. So moving this loss of range of motion isn't going to be a big deal. But now that you've lost this range of motion, it's probably going to be painful to lift it all the way up here. So you're just going to lift it to here and not really move it up. Again, you're not going to probably notice the fact that maybe it's a little uncomfortable, maybe it's painful, but you're just not a big deal. You can still lift overhead. But now this capsule is starting to shrink and it's starting to freeze even more. Now you've eliminated from here to here. This takes months to develop. This is not something that you are going to fall on your arm tomorrow and you're going to have frozen shoulder. This happens over time. It takes time for that capsule to freeze up. And then again, you're lifting here and now all of a sudden this starts to hurt because you haven't been using this much range of motion. So now your capsule has frozen from here to here. Now you're going to back off a little bit more. Well, now all of a sudden you're like, oh wait, I have to do this to lift overhead, or I have to do this to lift my arm. And that's when your capsule has completely started to frozen. And this is when we really start to see people come in for treatment on frozen shoulder because they just can't. They absolutely cannot move it here. It's probably painful right here at this end range. Again, not painful down here. Painful when you get up here, not able to move it any further. they're just hanging out here really unable to move anything. That's when we start to see them. But this is months and months and months of developing as you start to slowly shrink and slowly limit that range of motion until you're here and now all of a sudden you can't move it. So what do? So this is a very slow, gradual rehab process. Now, there is some surgeries that can be done to hasten the process, but they really are shying away from doing those now because you can tear your rotator cuff. So you want to be careful in rehabbing this because you can tear muscles around it. You have to loosen up that capsule, and a lot of it is range of motion exercises. So if you're at home and you've got a cane and you just want to start lifting that cane overhead and doing gentle range of motion exercise. Now, if you have adhesive capsulitis, you're probably getting to here, all right, and not really doing anything. If you want to do some wall walks, you know, where you're walking up the wall, helping your hand, kind of walking that arm up as far as you can get it. Again, there could be a rotator cuff tear in there also, so you want to make sure that you are seeking professional help and getting this diagnosed, and we always offer those free consultations. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. But you want to make sure that you are getting this properly diagnosed because there's usually something more at play here than just adhesive capsulitis. Adhesive capsulitis is something that we treat and something that we deal with, but we got to figure out exactly what caused it. Was it a hindrance? Was it a rotator cuff tear? What's going on in that shoulder that has caused that capsule to freeze or caused that range of motion to be extremely painful? All right, so the two exercises that I've showed you so far are just wall walking, where you're just kind of walking your fingers up the wall, trying to get as far as you can, holding it there, a little bit further, holding it there, and then if you have a stick, or if you don't have a stick, you can actually use your own arm to lift it as high as you can, and then back down. The main thing is you want to keep that shoulder moving. The last exercise you can do is just kind of this, where you're moving your body. Everyone likes to stand still and do this and move their arm. That's not the exercise. You want to really go back and forth, nice and easy, where you're just moving that arm, okay? So you're moving your body weight and the arm is just kind of dangling. That's going to help open that capsule up and get some of that fluid in there. This one really shouldn't hurt. You just want to go nice and easy, as much as you can, back and forth, nice and fluid, okay? Do that. That's an extenuating 5-minute exercise. You don't want to do this just for like a 30 repetition. You want to make sure you're really stretching that exercise out in order to open up the capsule. You can use ice if it's painful, but you know, I mean, it's usually not painful. Again, this kind of range of motion down here isn't too painful. It's only when you really start to work it and push some of that range of motion. But again, it's really important that you get it exactly diagnosed as what it is, find out if there's underlying tears there that are exacerbating this condition. If you or someone you know is suffering with shoulder pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.